Thank you for holding this hearing. My name is Dr. Meryl Nass. I practice internal medicine in Bar Harbor, and I'm also the new chairman of the Commission to Protect the Lives and Health of Members of the Maine National Guard. I've been practicing medicine 30 years, and I've actually testified for 6 different congressional committees federally, primarily on controversial medical military issues. My entire career I have spent observing controversies such as this one. My ex-husband was actually in Professor Blank's department, where Irving Selikoff proved that angiosarcomas, liver cancers, were caused by exposure to vinyl chloride in employees of the chemical industry. And he was hired eventually by the union after many employees had become ill and died, but there was no one to pay for the science that would actually show what was happening. Industry was very interested, of course, in paying for different science. And what I found over the years is that the so-called science is no longer pure, but it depends on who pays for it. Yeah. I myself had a benign tumor, which I don't think was due to cell phones, but that tumor is certainly promoted by estrogen, and there is some evidence that it's promoted by cell phone exposure. I am very grateful that I learned that estrogen and cell phones may promote that tumor because it has a high rate of recurrence, and I want to do everything I can to prevent it coming back. I was out of work almost a year with the first surgery. There's a tremendous amount of evidence about phony science. I gave you in my testimony one URL to an organization that I happen to be on the board of that explores phony science in medicine. To change the topic a little, there are many things that damage DNA and cause DNA breaks, not just cell phone emissions. The air you breathe, the food you eat, many things do it. But cell phones can do this in a concentrated fashion. All of us have mechanisms to repair DNA. Those mechanisms work better for some people than for others, but we can't identify who is most at risk. So the thing is, we have to make decisions that are prudent for populations because we don't know how to identify who really needs the protection. As far as people saying that the rate of brain tumors is flat, it is flat, but that's because 80% of these glioblastomas occur in people over 65. The rate in adolescents and young adults is in fact increasing. So you'll hear lots of terms, and I hope you'll be careful. It's a complicated subject, but in medicine we try to do what's prudent. We give lots of treatments to people, most of whom won't benefit, but when we do it on a population scale, we improve the health of the population considerably. Thank you very much.
Thank you, Doctor. You were here with Barbara earlier.
I was.
You're going to take, between you, you're going to take good care of our national
We're trying. Thank you.
Yes, and if anybody could give us any data on young people, a lot is being made of there's no increase in brain tumors nationally.
Yes.
If somebody could weed out and just have what the situation is with young people, that would be interesting. Thank you very much.
Questions?
Thank you. Next.